If you're over 70, some medical tests could actually do more harm than good, and one of them might even put your life at risk. Most people trust every test their doctor suggests, but what if some of those routine checkups are outdated, unnecessary, or even dangerous for your age? Stay with me, because what I'm about to share could protect your health, your money, and possibly your life. As we get older, our bodies change. What worked for us at 40 or 50 doesn't always apply after 70. And here's the truth most people don't hear. More testing does not always mean better health. In fact, too many tests can lead to stress, false alarms, unnecessary treatments, and serious complications. Today I'm going to walk you through 5 medical checkups I would personally avoid after age 70, or at least think twice about. And yes, the last one might shock you. Let's start with something very common: full-body screening scans. A lot of clinics promote these as a smart way to catch everything early. It sounds reassuring, right? But here's the problem. These scans often find things that are not dangerous at all. Small nodules, harmless growths, or age-related changes that would never cause symptoms. But once they're found, you can't ignore them. That leads to more tests, biopsies, anxiety, and sometimes risky procedures. Imagine being told you might have something serious, only to find out later it was nothing. That emotional stress alone can affect your health. And worse, some follow-up procedures carry real risks, especially for older adults. So instead of full body scans, focus on targeted testing based on your symptoms and medical history. That's safer and more effective. Now let's talk about prostate cancer screening for men, the PSA test. This one is very controversial. For younger men, it can sometimes help. But after 70, the risks often outweigh the benefits. Why? Because many prostate cancers grow extremely slowly. So slowly that they would never cause problems in your lifetime. But once detected, doctors may recommend treatments like surgery or radiation. And those treatments can lead to serious side effects, like incontinence or sexual dysfunction. So the real question becomes, are you treating a dangerous disease, or just something that would have never harmed you? Many health experts now suggest that men over 70 should carefully discuss whether this test is even necessary. It's not a one-size-fits-all decision. Next up, routine colonoscopies. Now don't get me wrong, colonoscopies can be life-saving for people between 50 and 65. But after 70 or 75, things change. The preparation alone can be very hard on the body. Dehydration, electrolyte imbalance, weakness, these are real risks, especially if you already have other health conditions. Then there's the procedure itself. It involves sedation, and in rare cases, complications like bleeding or perforation of the colon. These risks increase with age. At a certain point, the likelihood of benefit becomes lower than the risk of harm. Instead, less invasive options like stool-based tests may be safer alternatives. Always talk to your doctor about what makes sense for your situation. Now here's one many people don't expect: routine cardiac stress tests. These are often done to check heart health, especially if you have a history of heart issues. But if you're not experiencing symptoms like chest pain or shortness of breath, these tests may not be necessary. In fact, they can sometimes lead to false positives. That means the test suggests a problem that isn't actually there. And what happens next? More invasive procedures like angiograms, which come with their own risks. For older adults, unnecessary heart procedures can lead to complications, longer recovery times, and reduced quality of life. So unless you have clear symptoms, routine stress testing may not be the best choice. Let's move on to bone density scans. This one might surprise you. Bone density testing is important, especially for women. But after a certain age, especially if you've already been diagnosed with osteoporosis, repeating the test frequently may not provide much value. Why? Because the results often don't change your treatment plan, and yet people keep getting tested over and over again. Instead of focusing only on test results, it's more important to focus on prevention, like strength training, proper nutrition, and fall prevention. Now we come to the last one, and this is the one you really need to pay attention to: aggressive cancer screenings in general. This includes things like mammograms, CT scans, and other screenings done very frequently after age 70 or 75. Here's the reality. Not all cancers need to be found early, especially in older adults. Some cancers grow so slowly that they will never impact your life. But once detected, they often lead to aggressive treatments: chemotherapy, surgery, radiation. These treatments can be extremely hard on the body. In some cases, the treatment itself can reduce quality of life more than the disease would have. That's why many experts now focus on something called quality over quantity. It's not just about living longer, it's about living better. And yes, in certain situations, aggressive screening can lead to overdiagnosis and overtreatment, which can be dangerous. So what should you do instead? First, focus on how you feel. Your symptoms matter more than routine testing. Second, build a strong relationship with your doctor. Ask questions. Don't be afraid to say, "Do I really need this test?" Third, prioritize lifestyle. Nutrition, movement, sleep, and mental health are far more powerful than most people realize. Now let's talk about some common mistakes people make after 70. One big mistake is assuming more medical care always equals better care. That's simply not true. Another mistake is not questioning recommendations. Remember, guidelines change. What was recommended 10 years ago may not apply today. And finally, many people ignore their own intuition. If something doesn't feel right, speak up. Here are a few simple do's and don'ts to keep in mind. Do stay active. Even light walking can make a huge difference. Do eat whole, nutrient-rich foods. Do keep regular checkups, but make them meaningful, not excessive. Don't chase every test just because it's available. Don't ignore side effects from medications or procedures. And don't be afraid to get a second opinion. Now I want to hear from you. Have you ever had a medical test that caused more stress than benefit? Comment below and share your experience. Your story could help someone else make a better decision. And if you're finding this helpful, make sure to subscribe and turn on notifications. I share simple, science-based health tips to help you live better, especially as you age. Before we wrap up, let me remind you, this is not about avoiding healthcare. It's about making smarter, safer choices. Your health after 70 is not about doing more. It's about doing what truly matters. So next time a test is recommended, pause and ask, is this necessary? Will it improve my life? Or could it actually cause harm? That one question could change everything. Take care of your body, protect your peace of mind, and always choose quality of life over unnecessary risk. And before you make any decision about skipping or continuing a medical test, there's something extremely important you need to understand. This is not about fear. This is about awareness. Because the truth is, the medical system is designed to detect disease, not always to protect quality of life. And when you're over 70, those two things don't always align. Let's go deeper into how you can make smarter health decisions from this point forward. One of the most powerful tools you have is something very simple: asking better questions. Instead of automatically agreeing to every test, try asking your doctor questions like, what happens if I don't do this test? How will this result change my treatment? What are the risks at my age? These questions shift the conversation. They move you from being a passive patient to an informed decision maker. Because here's something most people don't realize. Many doctors actually appreciate when patients ask thoughtful questions. It shows that you care about your health, and it allows them to tailor recommendations specifically for you. Now let's talk about something that's rarely discussed: overdiagnosis. Overdiagnosis happens when a test finds a condition that would never have caused symptoms or harm during your lifetime. But once it's found, it's labeled as a disease. And that label changes everything. You may start treatments you didn't need. You may experience side effects that impact your daily life. And emotionally, you carry the burden of thinking you're sick, even when you feel fine. This is especially common with certain cancers in older adults. For example, small thyroid cancers, slow-growing prostate cancers, or early-stage breast changes. These are often detected through aggressive screening. But many of these would never progress into life-threatening conditions. And yet, once diagnosed, they often lead to surgery, medications, and ongoing monitoring. So the real risk is not just the disease. It's the cascade of interventions that follow. Now let's shift focus to something positive: what you should prioritize after 70. Because avoiding unnecessary tests is only half the equation. The other half is investing in what truly supports your health and longevity. Let's start with movement. You don't need intense workouts or complicated routines. In fact, simple daily movement is one of the most powerful things you can do. Walking, stretching, light resistance training. These help maintain muscle, improve balance, and reduce the risk of falls. Even 20 to 30 minutes a day can make a noticeable difference. Next is nutrition. As you age, your body becomes more sensitive to nutrient deficiencies. Protein becomes especially important for maintaining muscle mass. Focus on whole foods, vegetables, fruits, healthy fats, and clean protein sources. Stay hydrated as well. Many older adults don't feel thirst as strongly, which can lead to dehydration without realizing it. Now let's talk about sleep. Poor sleep is often accepted as a normal part of aging, but it doesn't have to be. Consistent sleep patterns, reducing screen time before bed, and creating a calm nighttime routine can improve sleep quality significantly. And better sleep means better energy, stronger immunity, and improved mental clarity. Speaking of mental clarity, brain health is another area that deserves attention. Instead of relying on scans or tests to check brain health, focus on keeping your mind active. Reading, learning new skills, social interaction. These are incredibly powerful for maintaining cognitive function. Loneliness, on the other hand, is a major risk factor for decline. So stay connected, talk to friends, spend time with family, join a community or group if possible. Now here's something that might surprise you. Your mindset plays a huge role in your health outcomes. People who believe they can stay active and healthy often do better than those who assume decline is inevitable. Your thoughts influence your habits, and your habits shape your future. So instead of thinking, "I'm too old for this," try asking, "What can I still improve?" That small shift can lead to big changes. Now let's address medications, because this is another area where more is not always better. Many people over 70 are on multiple medications. This is called polypharmacy. While some medications are necessary, taking too many can increase the risk of side effects, interactions, and even hospitalizations. Dizziness, confusion, fatigue, these are often caused by medications, not aging itself. So it's a good idea to review your medications regularly with your doctor or pharmacist. Ask if each one is still necessary. Ask if doses can be adjusted. And never stop a medication suddenly without guidance. Now let's talk about prevention, but in a smarter way. Instead of focusing only on disease detection, shift your attention to risk reduction. For example, fall prevention is one of the most important priorities after 70. Simple changes like improving lighting at home, removing loose rugs, and wearing proper footwear can prevent serious injuries. Balance exercises, like standing on one foot or practicing gentle yoga, can also help. Another key area is inflammation. Chronic inflammation is linked to many age-related conditions: heart disease, arthritis, cognitive decline. And the good news is, lifestyle plays a huge role in controlling it. Anti-inflammatory foods, regular movement, stress management, these can all help reduce inflammation naturally. Now let's revisit something we mentioned earlier: quality of life. This is the foundation of everything we're talking about, because at the end of the day, health is not just about numbers on a report or results from a scan. It's about how you feel. Can you move comfortably? Can you enjoy your day? Can you spend time with people you care about? These are the things that truly matter. So when considering any test or treatment, always bring it back to this question: will this improve my quality of life? If the answer is unclear, it's worth thinking twice. Now, I want to share a simple framework you can use whenever a medical test is recommended. Think of it as your personal decision filter. First, necessity. Is this test truly needed based on your symptoms or history? Second, benefit. What is the potential upside? Will it lead to a meaningful improvement? Third, risk. What are the possible downsides, especially at your age? Fourth, alternatives. Is there a safer or simpler option? And finally, timing. Does this need to be done now, or can it wait? This framework puts you back in control. Now let's talk about communication, because this can make or break your healthcare experience. Be honest with your doctor about your priorities. If your goal is to stay independent, say that. If you value comfort over aggressive treatment, express that clearly. Doctors can only guide you effectively if they understand what matters most to you. And if you ever feel rushed or unsure, don't hesitate to seek a second opinion. Good healthcare is a partnership, not a one-sided decision. Before we close, I want to remind you of something very important. Aging is not a disease, it's a natural process. And while certain risks increase with age, so does wisdom, resilience, and the ability to make better choices. You don't need to chase every test or follow every trend. You just need to focus on what truly supports your well-being. So take a moment today and reflect. Are you doing things out of habit or out of intention? Are your health decisions aligned with your goals? If not, it's never too late to make a change. And if this message resonated with you, share it with someone who might need to hear it. Because sometimes, the most powerful way to care for others is by helping them avoid unnecessary harm. Thank you for spending this time with me. Stay informed, stay active, and most importantly, stay in control of your health. I'll see you in the next video.